want to thank everyone for joining us on this latest edition of Talk It Out, an important show, especially with everything that's going on with the coronavirus. Joining me now is Dr. Dina, Doctor of Internal Medicine and Endocrinology, and Dr. Purvi Parikh, adult and pediatric allergist and immunologist. Thank you so much for taking the time. We were joking when we came in, our first instinct every time we meet someone new is to shake their hand, and now people are shying away from that, especially when you're just meeting from someone for the first time, and I'm walking around with hand sanitizer, and I'm sure that everyone is taking the precautions that are necessary. We're hearing so many different things. We've got a lot of questions from viewers that we put together that we want to go right to, and in between those, we're going to make sure that we take your questions. So let's get right into it, okay? So the first question is there a vaccine? I'll just let you two just kind of
Sure.
throw the information out there.
There is no vaccine yet,
Okay.
but there is a vaccine potentially in development, and so we hope that soon it will be available to
What
the
kind
public.
of timeline have you heard that we're looking at in terms of a vaccine? We know that there's testing that's going to start taking place towards the end of this week, national testing, state testing, but what about a vaccine, a timeline?
So it can take up to months because they have to, one, make sure it works and then also that it's safe. But what we are encouraging, and I'm sure Dr. Dina would agree, is for people to get other vaccines that are already available, such as your flu shot or your pneumonia shot, because you can still get just as sick with those two and you'll help ease the burden on our emergency personnel.
Some of these questions are going to sound out of left field.
Okay.
But, I mean, this is stuff that people are talking about. Is oregano oil effective against coronavirus? Now, I had never heard this, but apparently people are talking about this. Oregano oil, is there any truth to that?
Mm-hmm. So that's definitely a new one
Yeah.
that I haven't heard of yet in terms of oregano oil. I haven't heard of that actually being effective against coronavirus, but what we do know, and I'm sure many of our viewers have heard, is hand washing is one of the main ways that you can protect yourself from the coronavirus.
And not just a quick dip under
That's
the
right.
sink, right?
And
20 seconds?
20
That's
seconds.
right. And so, a lot of people nowadays have been talking about hand washing and are we hand washing appropriately? So typically we learned in medical school hand washing under the sink with soap for about 20 seconds or being able to sing happy birthday and then being complete.
And after you wash your hands, remember, don't touch your face
That's
because
right.
all of us touch our face 1,000 times a day. And you can easily contract any infection that way.
Yes.
But yeah, oregano oil probably won't help you much here.
Okay. Next up, are hand dryers effective in killing the new coronavirus?
So no, not the hand dryer.
Even
can't
the ones
kill
that
it
blow
off.
out the hot air, I guess, right?
I mean, they'll help once you wash your hands for 20 seconds, as Dr. Dina said, but they won't protect you against the virus itself. They won't kill any of the virus either.
That's right. And what's important also for people to remember, like you mentioned, after hand washing, make sure that you keep your hands clean, right? It's really easy in the hand dryers where you insert your hands in there and then your hands touch around
That's
the
true.
surfaces of the hand dryers
Right.
as well. So you have to be really careful. Probably the best option would just be getting a paper towel, wiping your hands, and then maybe even using that same paper towel to exit the bathroom or wherever you're coming from.
Okay. Next up, can regularly rinsing your nose with saline help prevent infection with the new coronavirus?
So that won't prevent infection.
I guess the idea is the salt water in your nose would kill whatever's in there.
Right. But once the virus has already entered your mucous membranes inside of your nose or mouth or eyes, unfortunately, rinsing it out does not work.
And I want to make sure that we get to some of these questions that are coming in live from our viewers. And one that I read near the top is, how do you know the difference between a common cold and coronavirus?
Right. So I think that's an excellent question and one that's been brought up multiple times by my patients. I think it's really difficult to know the difference in terms of the coronavirus. Some of the symptoms that you can expect might be a fever, a runny nose, a sore throat, which are also very common to be seen in the common cold. And so, if you're concerned or you're maybe considered as high risk, somebody who's traveled to an area with corona prevalent, such as China or Iran or Italy or Japan, some of those high risk countries, important if you have those symptoms to consider talking to your provider about maybe getting tested. But typically, it's very difficult to tell the difference between
Yes.
these. And especially now that we're entering into cold and flu season, or we've actually been in cold and flu season, it's becoming even more sort of difficult to know the difference.
Right, and the only other things that I would add is in speaking with Dr. Gold, who was at one of the quarantine centers for the cruise ship passengers, he mentioned that these fevers tend to be a lot higher than the common cold.
So if
that
you're
might
running
help.
a mild fever,
Yeah.
you really shouldn't be panicking.
Right.
But if you're at 102, 103, 104.
Right, and this novel coronavirus has more lung symptoms with it, so more respiratory symptoms over just a regular cold may or may not, but I agree, a lot of it is gray area.
Here's a good question from Diana Vargas Nesbeth. If it's spread through the droplets in the air, what does hand washing do? Now, is that true, that it's spread through air droplets? And then how effective is hand washing in light of that?
So it is spread through the air, but the problem is it lands on surfaces, and then from surfaces it can end up on your face. So if, let's say, it's on the surface of someone who has the virus or on their hands or on a table, by washing your hands, you're eliminating the chances of that virus ending up on your face or the droplets ending up on you.
That's right. So anything that's around you that can potentially have the virus on the surface, if you touch that and you touch your hand to your face or your mouth or your nose, you're potentially introducing that virus into those surfaces where it can then infect you. So that's why hand washing is important.
I've heard a lot of different pieces of information regarding how long coronavirus lives on a surface. I've heard anywhere from an hour. I've heard some like unbelievable times, like a week. Do we have any kind of guidance on that? If you sneeze and you're infected with coronavirus, and let's just say I sneeze all over this table, there are several shows here in the SMC. Does Dan Manarino, when he comes in tomorrow morning, have to worry about coronavirus still being on this coffee table?
So,
No, go
I was
ahead.
going to say there's a lot of unknowns about the
right.
coronavirus, so we're still learning how long it'll last on surfaces. A week seems a little too long, just logically speaking. I would guess, if I had to, maybe hours, but I personally don't know, and I think a lot of scientists may not yet.
Yeah.
I think that's what's scary.
And like you said, Jay, when you started the conversation, there's a lot of evolving information. As we learn more and more about this virus, we'll have more information to tell our patients and to tell the public to how to keep them safe. But for now, we just know the main things that you can do to sort of help yourself. So no matter what, if you're concerned about a surface, just making sure you're disinfecting it, making sure that you're decreasing your exposure to areas is what's really going to help keep you safe, potentially.
Okay. Let's get to another question that we collected from a couple of viewers in advance of this show. Does putting sesame oil block the new coronavirus from entering the body? Now, I guess this would be sort of the same thing as the oregano oil, but sesame oil?
Yeah,
Have we
it's
heard anything
interesting.
about
All
that?
these
I know.
spices are somehow coming into the media. I wouldn't say that that's something that's known to help in this circumstance. In fact, I can imagine sesame oil maybe causing more harm, especially because it can be a little bit caustic. So it may be actually damaging to the areas of where it's coming in touch with.
Okay.
And there's no studies suggesting that sesame oil or oregano may potentially be helpful here.
Let's move on to the next one.
Yes.
And this is a good one. Are antibiotics effective in preventing and or treating the coronavirus?
So the answer would be no, because coronavirus is a virus, and antibiotics are typically used to treat bacterial infections. So if you're having symptoms of a viral infection, typically antibiotics are not helpful.
And Dr. Parikh, I'm guessing you have a lot of patients. You're an immunologist.
Right.
People who are coming in.
Yes.
And they're asking, can I get some, whatever
Right.
antibiotic?
Yes,
Because
yes.
it's going to kill coronavirus.
Yeah, I get that request
Yes.
frequently, and frequently I have to say exactly what Dr. Dina just said. I know there are some studies starting for antivirals in coronavirus, but we don't have anything that we know is effective
right.
yet.
So here's a question that I have. Coronavirus, the regular flu, would medications like Tamiflu and the other prescription medications that you can get for the flu, do we know if they are effective against coronavirus?
So I think that again is an unknown. I think that there are some companies that are actually looking into potentially developing some antivirals, maybe against coronavirus. But from what we know right now, Tamiflu is not effective against the coronavirus.
Right, they're actually looking at the same antiviral they tried for Ebola, but wasn't that effective in Ebola. So now they just started testing patients with coronavirus with that, but we still don't know yet how effective it'll be.
Okay. And here's another question. Will a face mask protect you from COVID-19, from coronavirus?
Right,
Now,
so
this is a controversial question
Right,
because
right.
we were talking before the show started. a couple of nights ago, I was in front of Columbia Presbyterian, where the 50-year-old attorney is now being treated. I was in White Plains last night, where a school has been shut down till the end of the week because a couple of students there. So I've been seeing people walking down the streets with wearing these masks. Sometimes they're not the N95 mask; they're just a regular, hospital mask, I guess.
Surgical mask.
Are they effective? What do they accomplish?
Right, so the masks in general aren't very effective because the respiratory particles can still get behind the mask, especially if it is one of the paper masks. And then the N95 are, but the problem is that all of us healthcare professionals have to be fit tested so that we have the right N95 mask, make sure it fits our face. So
there are different sizes?
Exactly.
Okay.
So if you wear the wrong size, again, it reduces its efficacy.
So the N95 I know, and a lot of other masks, they have this metal band across the top.
Right.
You're supposed to pinch that against your nose, I guess?
So the N95 mask is a little bit different from these other lighter masks, which are surgical masks. So the N95 that's commonly seen is the one that's very dark green versus the surgical masks that are a little bit light bluer. The difference is that there's a barrier between the N95 mask that's much more thicker, and it actually has filters that are in that which will help keep out particles. So what's interesting is I see a lot of people around the city, wearing these surgical masks, and they're wearing it inappropriately. I don't know if you've seen that.
Right.
Wearing it on the wrong side, wearing it upside down, and really when it's worn in that capacity, it's not effective at all. I do think that when it comes to masks, it's important to talk to your healthcare provider because there are a group of patients who are considered as high risk, those that have comorbidities, different complications. I'm an endocrinologist, so I see a lot of patients with diabetes. It's a very common question that's been coming to me every day is, I have diabetes. Should I be concerned? Should I be wearing a mask?
Well, should they?
And there are some that I do recommend actually wearing a mask. So I think it's important to talk to your healthcare provider about your disease, about the medications that you take that might be suppressing your immune system also, to see if you should be protecting yourself in some way.
That was my next question. So would diabetes and other underlying conditions make you more vulnerable to coronavirus?
Yes, so what we've seen is, elderly people above 60 or 65, those with diabetes, heart disease, any type of weakened immune system, or underlying lung diseases. The good news is it seems that...
Cancer survivors?
Okay, oh, absolutely, yeah. Younger people who are otherwise healthy and children seem to be spared from the coronavirus,
right.
or as severe versions of it, which is nice.
There's one question here as we wrap up I want to get to, and it says, this is from Roger Philiba. If you sneezed and you have the virus, how far does it travel in the air? I'm guessing this is just a regular sneeze. We should be covering our... I mentioned this question because when you're sneezing, you shouldn't be sneezing into the air anyway, right?
Yeah, that's right.
So how should we be sneezing and coughing and...
Well, I think the first step is it's important for the most important people that should be wearing the mask are people who are exhibiting any symptoms of cold or they're sneezing or they're coughing. You want to protect yourself, but you also want to protect yourself from other people just in case you're spreading the infection. So if you're worried, if you feel like you're sick, you yourself should be concerned about keeping in isolation, and if you need to travel, to potentially put on a mask. They teach you at a very young age when you cough or you sneeze to sort of cough into yourself, like into your armpit or into your body, so that you're not, exposing other people. So one would suggest continuing to that. But the best advice we can give you is if you're worried and you have cold-like symptoms or you're feeling ill, stay home. Isolate yourself from other people so that way you're not spreading the infection.
Dr. Dina, Dr. Parikh, thank you so much for coming in. A lot of these questions, I'm glad that you were able to help answer and field some of the questions from our viewers. Obviously, this is a story that's going to continue to evolve. The number of cases, we're now approaching 24 in New York State. Keep an eye on the latest developments. We've been hearing about a number of school districts in our area that are closing down for sanitation, to sanitize the buildings. Make sure that you're paying attention to the email alerts that come from your school district. That's probably the best way if you have children to keep up to speed with the latest. Follow me on Facebook at JDow Journalist, JDow TV on the other platforms. Set up your alerts so you know when we're coming to you from the social media center here at Pix 11. Thanks for watching another edition of Talk It Out. See you soon.